Hi, everybody. This is Terry Myckatyn from West County Plastic Surgeons. I'm hoping that you guys can all see me now. We're just about to do a discussion on body contouring after massive weight loss. So that'll be the topic today. So please feel free to chime in with any questions that you guys may have on this topic. The first thing that I'm going to talk to you guys about is, some of the basic body parts that we can address after massive weight loss. And then the second thing that we'll talk about is sort of what makes somebody suitable for massive weight loss surgery. And then after that, we'll talk a little bit about what insurance doesn't cover, and some of the details of some of the main procedures. Um, so then the first thing is what kind of body parts can we address? And there are several options that can be addressed. So the most common ones are the abdomen. And so typically when somebody's lost a lot of weight, their abdomen deflates. And this essentially causes an excessive skin that can develop. Also, the muscles no longer have as much pressure on them. And so as a result of that, the muscles have sort of stretched out and they've separated from one another, but it leaves the diameter of your torso wide. So with some of these procedures like tummy tucks and body lifts, we can also tighten the muscles together to one another to narrow the waist. Another area that's commonly affected with weight loss would be in women, the breast tissue, and then in men, also the male breast tissue. In both cases, essentially the issue again is that your skin suit is too big for your body, meaning that you have an excess of skin and not as much volume to fill it out. So the goal is to tighten up that skin and make it so that it fits in contours better. So in women, that typically means things such as breast lifts, often breast implants, sometimes the insertion of supportive structures to hold the breast tissue up. And in men, that typically involves removing extra skin from the breast to make it a more masculine and flatter or tapered shape. Other areas that we often address would be the arms. So the arms, there can be sort of this excess of skin that can hang from the arm. And so what we're doing is placing a sort of a incision in the inseam of the arm here, and then removing some of the excess skin. Um, and then in addition to that, we often can do liposuction in the back of the arm to remove some of the fatty tissue that's back there in some folks. And then looking at other parts of the body, including the face. So oftentimes when somebody loses a lot of weight, there can be a redistribution of the fat of the face and a laxity of the skin of the face. So from a side view, I can't really look at the camera and do this, but this angle here can be made more oblique. So it's not as much of an acute angle, but it's kind of loosened up. So neck lifts to tighten that up are very common. Also, facelifts to bring up and tighten up the lower and the middle thirds of the face can also be performed. Often when you have so much volume loss, you can look somewhat sallow and deflated. So we can do fat grafting to add volume to the middle face area. That helps to recruit some of the skin and lift up the face. We can also use fat to inject into these are called the nasolabial folds, which differentiate the cheek from the lip. And then often these jowls can develop, and you can have a hollowing of this pre-jowl triangle. So we can add fat here, and we can tighten up the tissue as well to define the border of the jawline as well. And then often also of the face, there can even be such volume loss that eyebrows can drop, eyelid skin can get more loose, and those tissues can also be elevated and rejuvenated. And then we get to the thighs, And then certainly with weight loss, the thighs can look quite deflated as well. And so for the thighs, we're looking at removing extra skin as well. Typically, that can be done either with an incision in the groin crease on the inner part of the thigh or down the inseam of the thigh. And our decision as to where we make that incision largely revolves around just where that skin excess is. Then after that, um, there can be other issues as well. For example, excess skin in the back, in the bra strap roll area, or in the flank. And sometimes we can address that with what's called an upper body lift. So removing extra skin from the back to lift up the torso. And then also trying to get better contour around the buttocks or the waist. Rather than doing just a tummy tuck, we extend that incision all the way around like a belt. So going all the way 360 degrees around the torso to provide better contouring. And you'll see that called a lower body lift or a belt lipectomy or a circumferential body lift. So what are some of the things that we are looking at in patients who've lost a lot of weight and when they're considering surgery? So the first thing is we want to make sure that people have a nice long-term result. In order to achieve that, a couple important things. One is the fact that we want to make sure that our patients are healthy going in. This for us means that their nutrition is up to snuff because there are a lot of incisions. It's pretty substantial surgery, and we want to make sure that all those wounds heal properly, that scars heal properly, so that scars are minimized, and so that the post-operative course can be as smooth as possible. So this means, and it can often depend on how somebody lost weight, whether they did it with diet or exercise, the type of bariatric procedure they had done, but there can be deficiencies in various vitamins or micronutrients or cofactors that our digestive system requires or our digestive system absorbs so that we are sound nutritionally. So we definitely would want to take an inventory of somebody's nutritional status to make sure that if they need any supplementation, we get that taken care of. The second thing is going to be making sure that somebody has maintain their weight loss. So the best time to do this operation is when somebody has lost the weight that they plan on losing and have lost it and maintain that weight loss for several months. So that's an important feature here. So, typically we say that we want people to be at their goal weight for at least 3 months before we consider doing surgery. Some people may even want it longer than that, 6 months or longer. What we want to do though is make sure that the patient can hold that weight, but not just hold it, but do it safely and with good nutritional and lifestyle habits. So that pretty much is what we're looking for in terms of being suitable for surgery. Of course, we want to make sure that other medical issues have been taken care of. Often weight loss takes care of many on its own, things like sleep apnea, high blood pressure, diabetes, bleeding issues, and other things as well. Then the next thing that often comes up is, what is covered by insurance and what do patients pay for? So this typically revolves around contouring of the abdomen. And so there is a procedure that insurance covers, which is called a panniculectomy, meaning an operation that removes the excess overhanging skin and fatty tissue of the abdomen. This tissue is known as a pannus, and essentially we are removing that excess tissue. The purpose of that is so that that excess tissue no longer hangs over the pubic area, so that it can improve your hygiene, ability to wear clothes, ability to exercise, and can limit some skin irritation. So the reason why insurance covers it is because it is a way to limit downstream healthcare costs related to the problem of having this excess tissue. Often, for a paniculectomy to be covered by insurance, somebody has to have their body mass index, which is a measure of your weight versus your height. You need to have lost enough weight for them to cover that. That cutoff can be a body mass index of 30 or 35, um, and different insurance companies have different criteria for that. Often, we would also need a letter from your primary care doctor or some other physician that removing this pannus tissue will have medical benefit for you. Now, the paniculectomy is not a tummy tuck. It is simply removal of this excess overhanging tissue. In order for this to be more of a cosmetic result, that's the type of procedure that is not covered by insurance, and that is something that patients pay for out of pocket. The range of procedures, so for the abdomen, typically abdominoplasty, or more commonly, if folks have lost a lot of weight, an extended abdominoplasty, meaning that the incision is carried past the edges of the hip and then along onto the sides towards the back. And then a lower body lift or circumferential body lift is when that incision starts at the front, curves around the hips, goes around the sides, and then goes all the way back to meet in the middle at the back over the buttocks. And that is the operation that we can remove the most amount of skin. So in all of these aesthetic cosmetic procedures, we are typically tightening the abdominal muscles to one another at the same time. We are transposing the belly button. What that means is we are making sure that the belly button stays and that it is being left in its normal anatomical location, which is essentially in the center of the belly at the same level as the back of your pelvic crest. And that is why you will see somebody who has a tummy tuck with a scar around their belly button, as well as the scar along the base just above the underwear line. Typically, these procedures, well, they're all done under general anesthesia. We may or may not use drainage tubes depending on what other procedures are being done with it. We're typically removing all the skin from the belly button to just above the pubic area. And so in somebody who's lost a lot of weight, especially if we go all the way around, we are literally removing several feet of skin, and it's a very dramatic improvement in the contour. Then the next procedure that I find very rewarding that we do for patients often is some type of a breast lift procedure. A breast lift procedure, in the cases of somebody who's lost a lot of weight, is going to be done in order to remove extra skin from the breast tissue. Typically, women who've had a breast lift will have a scar around the nipple areola, a vertical scar down to the base of the breast, and then one typically along the bottom of the chest as well. And sometimes people call that an anchor scar. And the purpose of that scar is to remove extra skin, keep the scars below the nipple, and also reposition the nipple into a more cosmetically appealing and anatomically correct location. The breast lift can often be accompanied by a breast implant as well. The reason that somebody may want to do that would be to increase the amount of upper pole fullness in the breast, so that rather than a more of a ski sloped type of a contour, there's more fullness in the upper part of the breast. Another reason is simply to recruit more skin so that we can sort of stretch that tissue out a little bit and get more of a rounder shape to the breast. And of course, a breast lift or a breast implant will also add breast volume. So for somebody who feels that they're just very deflated, the implant can add volume. Now, sometimes because the soft tissues can be very weak after weight loss, we will place some type of a supportive structure to hold the implant in place. Sometimes we can actually use the patient's own tissues to achieve that. And sometimes we can use a mesh product, either a synthetic mesh or a mesh, which is essentially constructed from biologic materials to add support and hold the implant in position so it doesn't drop down over time because the skin tissue can't hold it up. Um, and then, sort of moving on from there, arms are a very common procedure again that we kind of talked a little bit about that we address. Um, the way that that operation works is we identify the extra skin that's present, and then we are removing the excess skin, and then we're sewing it together and closing things in a straight line. Often that line can be right in the crease here between the biceps and the triceps muscle. And then other times we can place that scar a little bit further back so that when somebody has their arm by the side, it's well concealed. We can do that both ways, and we often will do that based on the preference of our patient. That operation we can often do without any drainage tubes. And again, often that one is accompanied by a bit of liposuction. Um, Once that operation is done, we will typically wrap the patient's arm in a compressive garment or an ACE wrap to try and control swelling. And then after that procedure, several weeks later, we will often use various adhesives to try to put pressure on that repair, on those stitches, to prevent spreading of the scar and to provide a cosmetically nicer looking scar. Um, Now, so we've talked about the arms, the breast, and the trunk. So one question may be, can we do this all at the same time? And the answer is yes. There's been quite a bit of research done as to whether it's safe to do all those procedures at the same time. I think the important thing about it is that you want to make sure that the plastic surgeon that you're working with is comfortable doing that. You always want to make sure that you select operations that your plastic surgeon is comfortable with, because obviously that's what they feel they can do the best job with, and they have the expertise to make those decisions and also know their practice and their skill set and their resources best. um, in terms of the overall safety of it, yeah, that those three can be done at the same time. The reason why you may not want to do them at the same time would be either because you may have some medical issue where it may not be as appropriate to have a longer general anesthetic. Um, some people just don't want the downtime associated with combining the procedures. And then the other thing to consider is cost. As you add more procedures, the length of surgery increases, and that does increase cost as well. Having said that, if you bundle procedures together, the overall time for getting 3 procedures done is less, and there is also cost incentivization, making it cheaper to do them at the same time. You have to consider various things. One major thing when people have had weight loss surgery is to consider concerns with blood clots. So we often will use a blood thinner that is injected to prevent development of a blood clot. Typically, in patients who don't have a personal or family history of blood clots, we'll have them use this injected blood thinner for about 5 to 7 days after surgery. Patients who have a family or personal history of blood clots, we look at much more carefully. We see if there's a genetic predisposition to developing a blood clot, and then we'll change our what's called anticoagulation or blood clot prevention strategy based on what's going on there. Those patients can still have surgery, but we spend more time working with them to make that the safest option for them. Now, in terms of follow-up for these procedures and what kinds of complications that can arise, so the big thing is that if somebody has had these procedures, there's long incisions and there can be some scars. So the big thing is to manage wound healing issues. So again, that goes back to what we talked about at the very beginning, meaning that somebody's nutrition is good and that their health is good, so that when they have these procedures, they're giving themselves a good chance to have a nice, healthy wound. Um, People typically are going to have to take off anywhere from 4 to 6 weeks after extended abdominoplasty, arm surgery. Breast surgery typically has a shorter recovery, more like 2 or 3 weeks. Um, the most intensive of all the procedures, in my opinion, is thigh-based procedures. They have a higher risk of wound healing problems and scar breakdown. So those patients typically require the most amount of time to recover, typically in the range of about 6 to 8 weeks. Those patients can also have drains the longest. Those drains can sometimes be in there for 4 weeks or more. Um, at the end of the day, every patient is going to have a bit of a different experience, and we're going to tell them something a little bit different about what we would recommend. We definitely try to tailor the operations and our strategy to the patient. And that's not just the surgery, that's what procedures are done, when we do them, how we often will stagger them, kind of how we set up the follow up as well. But the other reality here is that patients who have lost a tremendous amount of weight should be commended for that. It's a great accomplishment. Um, but often, most of those people feel like they haven't finished their journey yet. So they've lost all this weight, sometimes 100, 200, 250 pounds in some cases. But now they're stuck with a lot of extra skin that diet and exercise won't make go away. So it's very rewarding for us to be able to remove that skin for our patients. Um, it's very rewarding. It's visually very dramatic surgery because of some of the results that we can achieve. But at the same time, it's really important for patients to be well educated and understand what they're getting themselves into and what they can expect. Um, Again, as with all complicated cosmetic surgery procedures, we would recommend that you see an experienced plastic surgeon that's certified by the American Board of Plastic Surgery. Thank you so much for attending this video. I don't see any particular questions at this point. Um, so I will sign off, but please feel free to contact the office if you have any. And also, if you can contact the office and tell us which types of Facebook Live presentations you'd like to see from Dr. Tenenbaum and I, we'd be more than happy to do those for you. We're doing these for the St. Louis community and our patients at large, and we'd be happy to answer questions and provide some information about plastic surgery. Thank you.